Directions for the use of a special pathogens waste kit. The supplies in this kit are intended to safely contain for transport and eventual destruction the waste generated in the care of a patient with or suspected of having a Category A pathogen. The details for packaging and transporting this waste are available from the Department of Transportation's PHMSA, or Pipeline and Hazardous Material Safety Administration. The guidance was updated in April of 2024, and also from Special Permit 16279. These include the specifications for the barrels or drums, the liner bags, absorbent materials, the cleaning, and labeling. As part of your Identify, Isolate, Inform process, we encourage you to notify your waste vendor along with your public health partners as soon as a suspect case has been identified. The supplies and processes here apply to all waste generated in the care of patients with a high-consequence infectious disease, such as Ebola, Marburg, or Lassa fever, that might come from a patient care space, a laboratory, or from EMS transport. Waste from suspect or unconfirmed cases should be treated as Category A waste until proven otherwise, and handled with care by people using appropriate personal protective equipment. Waste from these suspect cases can be packaged according to these instructions and held or sequestered until confirmatory testing is completed. Facilities should comply with any additional state, local, tribal, or territorial requirements for storage time, temperature control, or volume of waste. Additional details are available within the PHMSA document. Supplies needed include PG2 compliant waste transport barrels like these, with locking lids, liner bags, zip ties, and absorbent material. If you have other barrels, like green fiberboard barrels, they may be used if approved by your waste vendor. The packaging will not differ. Some vendors may also supply a sharps box and disinfectant. Only the disinfectant, if provided, has an expiration date. These vendor transport barrels are the ones that will be picked up and disposed of off-site by your waste vendor or hauling company and must be prepared and staged in a clean area outside any contaminated or hot zone. To start, prepare these transport barrels to receive the packaged waste. Each barrel should first receive absorbent material such as 2 inches of vermiculite in the bottom or absorbent pads. After the absorbent material is in the bottom of the empty barrel, place 2 heavy liner bags inside the barrel, cuffing each of them around the outer rim so that they can safely receive packaged waste and then be closed separately. Depending on the size and shape of the barrel and the height of staff members, it may be easier to stage these barrels on a pallet, skid, or cart to facilitate their movement. These barrels are now ready to receive our packaged waste. Waste from inside the patient room, lab, or from EMS should be placed into leak-proof bags, such as biohazard or red bags, and then securely closed using a balloon knot, zip tie, or looped and taped to prevent any leaks. While not required, we recommend double bagging this waste where it is created, either at the bedside, the lab, or in a transport vehicle, closing both bags in a secure manner. That means it is important to not overfill bags so that they can be securely closed and so that staff can lift, disinfect, and move these bags. If there's a risk of contamination to the outer bag in packaging, closing, or moving it, consider disinfecting the outer surface. The use of a disinfectant on the outer bag is not required when moving this double-bagged waste. Do not add liquid disinfectant or bleach to any bagged waste. If waste needs to be moved within your facility or collected from multiple locations within your facility, you can use a leak-proof rolling waste barrel to move the packaged waste to where you have staged the vendor barrels in the clean area. Securely bagged waste can be handed out directly into the vendor-supplied and prepared waste barrels, as long as those vendor waste barrels do not enter a contaminated space. Once the vendor waste barrel is full, gather and close the first liner bag using the provided zip tie or other secure closure method, like a balloon knot or loop and tape. Disinfect the exposed surface of the first liner bag. Repeat these steps for the outermost liner bag, ensuring that it is closed securely and disinfecting the exposed surface. Close the barrel by putting the lid in place and then applying the locking ring to the top edge. Secure the clasp or clamp, then perform hand hygiene or a glove change before disinfecting the outside of the barrel and lid. Once dry, apply the appropriate labels to the barrel. A few notes about special waste. Make sure not to exceed the weight limit of the barrel or overfill the liner bags. Sharp boxes should be closed securely before using an EPA-registered disinfectant on the surface, then placing them into a liner bag. If you have items that contain liquids, like suction canisters or specimen cups, solidify the liquids when possible and add sufficient absorbent material to their primary bag to prevent any spills or leaks. If, after consulting with your infection prevention team, you have larger or bulkier items that cannot be decontaminated with an EPA-registered disinfectant, facilities should notify their waste vendor for instructions. To recap, the steps are: notify your waste vendor and public health as soon as a suspect case is identified. Prepare the vendor transport barrels in a clean space by adding absorbent material and then lining them with 2 liner bags. Securely close and double bag waste where it is generated and do not overfill bags. Wipe the outside of the second bag before handing it out of the hot zone. Once the vendor transport barrels are 2/3 to 3/4 full, close the inner and outer liner bags securely and disinfect the exposed surface of those liner bags. Close the barrel and disinfect the barrel, lid, and locking mechanism. Apply the appropriate labels.